I think we're good to get started here. I'm going to give us a little intro. Welcome to day 3 of Brigade Congress, our last day. Won't get too sentimental here, which is fine. Important stuff to talk about here. We abide by Code for America's Code of Conduct. That includes if you have any concerns you need to raise about anyone or any participant making you feel uncomfortable or engaging in what's categorized as harassing behavior, please send that to us at safespace@codeforamerica.org. You can also check out that link there, which will show you what we mean by harassing behavior. Other important and fun things. Today, we also have some unconference sessions. In addition to a full lineup of programming, we've got first aid. How can we provide immediate support to brigades at 11 a.m. Pacific? So that's in an hour. We've got onboarding and managing volunteers at 12 p.m. Pacific, 3 p.m. Eastern. Those are our 2 sessions today for Unconference. We also have a training provided by Lauren Ellen McCann, who was in our keynote conversation the other day on Friday, and that is going to be at 12:30 Pacific. That's a 90-minute. Be ready for it. Come prepared to be present. I'm sure we'll have some breaks as well. I am M. Burnett, they, them pronouns, coming from Portland, Maine, member of the network team and also on the National Advisory Council, and really excited for our conversation this morning. I think this covers most of what I needed to cover in our intro. Yes, this is going to be recorded. It is actively being recorded. We'll upload this, and just apologies because our live transcription works for the normal Zoom instances, and it's not working live right now for the webinar, but the recording, I think we'll be able to figure out the transcription part. So all of that being said, please feel free to add your comments in the chat, comments, thoughts, feelings, discussions, links. And at the end of our conversation, we'll have a Q&A portion, and use the Q&A box for that if you can. And without further ado, I'm going to pass it over to Rene and Amy Jo.
Thanks. Yep, I'm Rene Joy. My pronouns are she, her. As a writer and peer support specialist, I use my lived experience with poverty and disability to advocate for socioeconomic equality in our safety net programs and system of care and support. I'm slowly but certainly integrating myself into the Code for America sphere near and far so I can share my work and share in all the work CFA and the Brigade Network are focused on. Most recently, I applied for and was selected to join the 2020 Brigade Congress Content Committee. That's very difficult for my mouth to say. I call it the B3C personally. And I'm so excited that this opportunity has led to our discussion happening today. So Amy Jo, thank you so much for joining us this weekend. Your advocacy work sets a really powerful example for revealing the vulnerabilities low-income people face when we navigate a broken system built on bad policy. Please share about your work.
Hi, thanks for having me. My name is Amy Jo Hutchison, and I'm a community organizer here in West Virginia. I'm born and raised in West Virginia. We have one of the highest poverty rates and one of the highest child poverty rates in the nation. So most of my work is focused around my lived experience. My lived experience is I really haven't spent a day in my life financially stable, and I'm the only parent of 2 teenagers right now. So I tell everyone I'm on the 5-year plan. My youngest will be 18 in 5 years. But most of my work is surrounded around organizing poor folks so we can push back against hurtful policy, especially around safety net issues. Sometimes local issues, sometimes on the state level and sometimes on the federal level, but most of my work is centered around the safety net and what that means whenever the policy comes around, policy changes are hitting, and people are kicked off the rolls where they have to struggle even harder to make ends meet. So that's the focus of my work. And I want to apologize. I have cats playing in the background. My dog was chasing the cat. So if it gets too out of hand here, I might have to go off camera. But
no problem. When we were prepping, I explained that I have cats and kids and Florida storms and a fan on. We're just living our life. Right. So again, thank you so much. I think, some of the topics we're really interested in covering today are, our experiences with like underdeveloped infrastructure and resources. What happens when certain companies are working with safety net programs and they're not taking into considerations the recipients they're designing these things around. And then also what that bad policy looks like. So on that first topic, what does internet service look like in West Virginia with all of those facts you shared about, where it sits on the spectrum of poverty in the nation? How does that work there?
We have a horrible time with internet here. A lot of it has to do with our geography. We're very mountainous, right? We're known as the mountain state, mountain mamas. And so right now we're experiencing huge problems because we just don't have access, and especially with the kids being put on remote learning because of the COVID virus. We have school buses now across the state that have hotspots on them. A woman I know posted the other day, she lives in a rural county, and she said that there were 25 cars in a parking lot around the school bus just because they need that hotspot. So I'm sure you can imagine how hard and difficult it is for kids to get their work done if they're only allowed to access internet from this time to this time off of a mobile hotspot in a public parking lot. Because we also have transportation issues here, public transportation issues. Again, a lot of that has to do with our geography. We do have a lot of hollers and we have a ton of hills. And so some people just don't even have access to transportation that can get them back and forth like that. So broadband is something that our federal representatives are constantly talking about and working on. Our governor just allotted $50 million of the CARES Act money to be able to try to expand broadband. But I will say that it's never really seemed to be a priority for West Virginia. I believe I was talking to you and Em the other day, and I said we just had a huge press conference because West Virginia has been selected as a Hyperloop train depot. And so we're talking about that, but yet we have kids that can't get their homework done right now because they don't have any internet. I mean, even myself, it's kind of touch and go. And I think God's really honest about that. I said, I might end up in the car going to sit in the restaurant's parking lot for this conference. I don't even live in a rural spot, but it's just because we're surrounded by so much that it's always hit and miss.
Yeah. When we were talking, I completely forgot about my own situation because I just wasn't, I'm almost have a Stockholm syndrome with some of the facts of life, that I forget, oh, that's an issue too. I live right outside of Orlando, and I live very near, I live in a very small neighborhood that's very run down, surrounded by very, very nice neighborhoods. And all of these nice neighborhoods have, the kinds of service and underground wires that they need and everything like that. But in my particular space, I only have 2 service providers to choose from. One is a DSL broadband, like a phone line based broadband, and then the other is the cable broadband. And the phone lines here haven't, they're not going to be updated anytime soon. So the highest I can get with one provider is 3 megabytes. That's it. That's all they can do. And they can't tell me when they might be upgrading any of that, just in this little 4-street spot surrounded by all this other much more developed, fancier things. And I'm in the House of Mouse. I'm in Orlando. That's not a rural spot. So how many providers do you have providers to choose from, or is it just one provider over there?
No, right now my situation is pretty much the same as yours. We have Verizon, who is a phone company.
Right.
I have an aunt and uncle who actually still have dial-up internet. So that's not uncommon around here. And then we have Comcast, Xfinity, which is a cable provider with the internet. AT&T has tried to do Wi-Fi TV here, which makes me laugh because there's no way, like my kids would never be able to function on Wi-Fi Netflix. So
Yeah.
yeah, but it seems to be pretty much the same situation. You know, we have like Comcast has a special package where if you're a student now, they'll you can get internet access for like $9 a month or $10 a month, you know, and so everyone thinks that's fantastic. But when it comes to the fact that it wouldn't matter if you could pay for it, you still wouldn't be able to access that service. So
Right. Yeah. And segueing from there, you know, when we're talking about the kind of control that these, you know, like the internet companies have over how their systems are improved, and then again, in that similar infrastructure vein, we have safety nets who are using software programs by companies that don't have the recipient's interests at heart. And I know that you have some direct experience with that as well. And I have experience, but I'm really interested in hearing more about the work you've been doing with that, or at least your, you know, the awareness that you've been building on that with the software developers in your area.
yeah, so and actually this was a pretty organic conversation, I think. I found out over the summer, I was talking to friends of mine, organizing friends of mine in Indiana. Actually it was last summer, 2 summers ago, but pre-COVID summer. But they were talking about doing protests for a company called Maximus. And so I was real surprised when I heard about Maximus and, you know, what they were doing and how it was harming people in the safety net programs. But I was very confident that I had never heard of Maximus and that I really didn't need to be concerned. And then they went and did just a quick internet search, and they sent me an email, and they're like, Amy Jo, you definitely need to be concerned. They have an office building set up in your state capital. And so when I started to look into Maximus, I had known that the state of West Virginia was paying a company money to process all the safety net applications, but I really didn't understand what the implications of that would be. And so my cat's talking to you.
Fine.
Sorry. But so one of the things that happens is that Maximus is paid by the state to process all of these safety net applications, and they do this under the ruse of we need to help move people off the safety net. We're going to provide you, instruction and the support you need to do this. This is going to be better for everyone in the long run. And so what happens is they receive a portion of money, I call them kickbacks, from every application that they process. And so there was a point in time where we were seeing an increased number of people who were just being kicked off of benefits, and then they would have to reapply. And then it started making sense to me. And I'm like, yeah, because if they get a kickback from every time they touch an application, then it's most definitely in their benefit to kick people off the safety net programs. So they have to reapply again under the guise of it being a clerical error. Reading up on it, like the state of Tennessee, they actually went back against Maximus because there were so many children who were losing access to Medicaid and CHIP insurance. They couldn't figure it out. And then they actually went and called Maximus on the rug for that. And so there were seniors, they would go to the drugstore, and if they were on Medicaid, their prescriptions weren't being filled, and so they would always just call it a clerical error. And so if you go and look at the Maximus website, I think Em shared the link to a Mother Jones article. They kind of were a whistleblower. But if you go and look at the Maximus website, they talk about helping the whole family. They want to end generational poverty by getting people back to work, right? Which, that sounds fantastic. I don't know. I work with nothing but impacted poor folks. But I don't know any of the welfare queens that we talk about. I don't know anyone who doesn't want to. Right. I don't know anyone who doesn't want a better position in life, right?
Yeah.
So it's not really the fact that they don't want to work. It's the fact that we don't have the supports here in West Virginia to get them to that point where they're going to be able to join the workforce and then remove themselves from poverty. But, Maximus is pretty much that pull yourself up by the bootstraps. They're pretty much the embodiment of all that. So it looks and sounds great on paper, but in effect, it's just very harmful to people stuck within that system.
Yeah. that self-sufficiency language, it's so toxically woven into the whole safety net program, because it sounds like a perfectly rational thing to want and to promote, but it's actually weaponized instead of used as a supportive way to promote people improve their lives. It's weaponized
Absolutely.
against them. I was really struck by the way that you related, like, oh, Maximus, that's y'all. Yeah, I don't know nothing about that. Well, here in Florida, we've had so many issues with the unemployment system, and there's been so much talk in the news about that being, Deloitte is the company that was contracted to put together that system, and there's all that focus. All of my work is usually focused on SNAP and Medicaid, and so I was like, wow, Deloitte, that's terrible. I can't believe that, huh? I've got a lot of problems with the SNAP and Medicaid system too. Well, lo and behold, Deloitte made the system for SNAP and Medicaid as well. And I just didn't realize that until we were doing a design audit, and the co-captain of the brigade near here was researching and getting the facts, put together, and like, oh, Deloitte's this contractor. And I'm like, wait a minute. And in part of my work, I'm creating like a personal welfare cliff calculator. And one of the main things I struggled with all the time was getting the SNAP calculations right. Even though it's plainly written in order of operations in the policy manual, publicly available, it didn't matter that I followed it to the T. I wasn't getting the same number that they were giving me. And I was like, okay, well, who's getting it wrong here? Is it my interpretation of the policy manual that I'm messing up? That's the most likely thing. But no matter how many times I've sweated over it or asked questions or gone back and forth, I'm interpreting it technically correct. So what's wrong? And I put in a public records request, being really sassy as I am. I put in a public records request because a thing you can request is software. And I said, hey, I want to see your calculation of benefits. I'd like to compare it with mine. I'd like to see what's that about. And the records request department, which is run through DCF, said, we don't use a software to calculate benefits. Long story short, I said, yes, you do. And they said, oh, you're right, we do. But in order to get only just the piece that you need, just a tiny, tiny, tiny little piece of it, you have to pay about $100 per hour contract hours for that. And it's going to be $3,000 some odd dollars. They want to charge $3,000, which they're legally allowed to do. But that's Deloitte. Deloitte's their contractor asking for that price tag to get just the smallest piece to try and fact check something that I should have every right to know, since it's determining the sustenance of my life. Like, are you kidding me? Yeah, so I really resonated with that as well. Gosh.
Well, I think back in 2018 was the date of that Mother Jones article, but Maximus was operating in at least 25 states back then. So I'm sure that it wouldn't take very long to realize that they're probably in a lot of people's backyards and we just don't notice it.
Right.
Not to mention how it hinders the state from even being able to do their own work. I think that's another part of all this, so.
Yeah, I would be really interested in sort of doing a meta review of those, which states are using which contractors. I think, there's probably like a top 5 and that kind of do it all. And it would be really interesting to try and, like, I guess, compare them.
Yes, I agree.
Yeah. And what was something else that disturbed me too was that, something that happened in Pennsylvania that I was told by somebody else is that a case was raised that, again, according to a policy manual's description of how benefits should be calculated, a recipient was getting a certain number, the agency was getting a different number. It was determined that the software was computing things differently than described in the policy manual, which is a literal interpretation of how the legislation is written. And the agency's software was said to be the one who wins out against that. Like, if there's a discrepancy between what the policy manual says and how the software is written, whatever the software says is the benefit, that's the thing that is true. And I was just so incredibly shocked by that. So when you're thinking about technologists or nonprofits who are coming into your area with these great tech ideas, what is it that you think they're missing, or what is it that you would want to tell them to do?
Any
If you
kind of
think,
tech?
yeah,
Like,
I mean, I guess if you were like, what's a wish list item? I mean, I guess plowing through mountains to get internet
yeah, that would be the biggest.
would be like a thing to say, but even that, of course, has so many more complications. But yeah.
I think internet access, we're West Virginia, I'm trying to find a way to say this gently. West Virginia boasts one of the highest graduation rates in the nation. And how they do that is we're lowering the graduation requirements. So 1/4 of our students are graduating at this highest rate, find themselves in remedial reading and math classes should they go to college. And then tie that to the fact that I've had a student in a high school in the Coalfields, which is, that's a part of West Virginia with the Blair Mountain, the March on Blair Mountain, and the Matewan mining. But, that's a movie about the unionization of mines. So that area right now has been extremely hard hit with devastation just because of the coal industry. And there are students there that told me 2 years ago that they were learning from textbooks that were copyrighted in 1989.
Mm.
So, I graduated from high school in 1989, and I'm going to be 49 years old here in a week or two. And I looked at the girl and I said, you may very well be using my science book. So that blew my mind. And so we're missing so much here, as I'm not just in terms of education, but I have my kids are 16 and 13 years old, and I'm constantly telling them, I'm like, my generation is going to start this fight and we're going to blaze the trail, but your generation is really going to be the one that comes and brings it home. And so whenever I think that these kids aren't even getting an education because they don't have internet access, think about how much just their learning is dwarfed, and their worldview. I think that is a part about the lack of internet access that we really don't talk about enough here. But we have such a narrow worldview in West Virginia. And I think it's because we just don't have all that access to how other places do things and how other places and people look and how, the different norms that can exist within society. And so I definitely think that broadband would be my number one priority when it came to technology for so many reasons.
Right. And I'm wondering too, how are like TV station broadcasts out there as well? Is that also very disrupted by the mountains? Was that move to like the digital broadcast made it difficult to get certain information as well? Like, I don't watch a TV hooked up to an antenna anymore myself, but that's like, what does that look like? Yeah. I mean, that's a major way of consuming content for folks who don't have that broadband access. Are there any initiatives that try to put like educational content or local content out there on on television stations or anything like that?
No, we don't. That's another thing about West Virginia is they just don't try to stretch their imagination or the way they approach things, and you can drive down, and I know that y'all know what I'm talking about. They still have those huge satellite dishes that are like half the size of their house, right? So you see those a lot of places. I mean, so usually our bigger cities have their own news stations that covers a pretty large area, so we don't have a lot of those either. And one of the things about West Virginia is you can go into a town and one part of that town will look like it's extremely like cosmopolitan and, trendy. And then you can go right up the road and you're on a dirt holler with no asphalt. So that's one of the challenges. And with my job, I'm assigned a region. We have 55 counties in West Virginia. I live in the very northern part of West Virginia. So I'm like an hour and 10 minutes outside of Pittsburgh, to put it in perspective. And it takes me 2 hours to get to Columbus, Ohio. So my county is one of the wealthiest and one of the most well-off counties in the state, but I cover 19 counties in my region, and it's a big joke that it takes me 3 hours to get anywhere, because most of the places I travel, just because the way you have to go around the mountains, and we call it going around our elbow to get to our ass. That's how that's how we say it here. But it's a 3-hour trip, and most of those trips I'm without any type of phone service. I mean, so that's what people say is, well, everyone has a smartphone. Well, not everyone has a smartphone here because it just doesn't make sense. Right.
Yeah.
And, so like in a lot of places, it really doesn't, that's not the fix for the world's problems either, is a smartphone with a data plan. Yeah.
Right.
There's
Really
so much we could
powerful.
do, right? But there is this like almost a cold camp mentality that exists here in West Virginia. And it's, like we work for the man, we live where the man tells us to, we pay the man to live there, we go and, use our wages to buy the dynamite to blow up in the mine for the man, and so it's, we have this tendency to just elect folks who really aren't going to have those out of the box ideas and those real innovative approaches. Our governor owns coal mines. So
Right.
yeah.
Right.
Joe Manchin is our senator. He owns coal mines, or did, so we're very dominated by the coal industry, even as far as our government goes. So that kind of thwarts a lot of the innovation.
So when you are talking to community members who have that mentality, what does building solidarity with them look like, or what does engagement look like for them? What kind of outreach is actually effective at asking them what their needs are, or revealing what they are?
Are you talking the poor folks or the government folks, or both?
Well, I tend to focus on how do we talk to the community to excite and engage the community to learn about issues, and then advocate for the right solutions. But the right solution, of course, is such a subjective thing in many cases. I apologize. I'm trying to like form my question at the same time as I'm trying to ask it, so I'm getting nowhere fast with that. I guess if like if we're here asking questions as outsiders, so if outsiders were coming in, what kind of awareness is necessary to show that there's not only compassion but acknowledgement there? What kind of, I don't know. I'm so sorry.
No, that's all right. I think, usually my position is grant funded, so a lot of times my deliverables are determined for me. Right. So if I'm my position is being funded by someone who wants to work on SNAP, then that's what my conversations are around. I do have organic conversations as far as, what's going on in your community that you think would, if we could change it, that would improve your quality of life. And then what do we need to do together? Like, how can I help you build your resource network in order to make this happen? And so it's just a lot of different ways. People understand that we have so many struggles. It's like when I'm talking to people in power who have that bootstrap mentality, I try to approach them with just the attitude of, look, we both want the same things, right? We want workforce participation to improve. We want the poverty level to drop, but we need to do that the right way. And so West Virginia just has so many problems. Like we have 7 counties without any childcare available at all, and so it shouldn't come as a big surprise to the electeds that those are the counties with our highest unemployment rates. We have one county where there was just community members at a meal somewhere, and they were talking about why their poverty rate was so high. And when they went and looked at census data, it was because they had over 1,000 households in that county that was led by unmarried women, and there was no childcare available. So like I try to have those conversations, like, what do we need to do? I truly wish, because it would benefit me and my family. But I really wish there was just like this magic wand that we could say, hey, let's just write one policy and poverty is going to disappear. But everything is so intersectional, and everything
Yeah.
is, bound to something else.
Right.
That's just, it's really narrow sighted.
So now I became familiar with you because of the talk that you gave about changing the official poverty measure, which is a major part of my own work. Can you share for anyone else who may not be aware of that conversation, what were you speaking on that day when it comes to the poverty measure?
Yeah, so there was talk, again, this was in February, so kind of COVID didn't hit here in West Virginia until March. So when I say pre-COVID, I'm talking about before March.
Right.
But there was talk from the Republicans that they wanted to adjust the federal poverty guidelines that came from the president and his administration. And so, people were like, oh, that's going to be fantastic. And I'm like, wait a minute, they're just tweaking the numbers. So people weren't less poor. It's just, whenever you start messing with these guidelines, it's just going to appear like they're less poor, right? Because they're still going to be in poverty. They're just not going to be able to qualify for any assistance. And that's the type of policy that we're talking about. What's the expression? You can put lipstick on a pig and it's still going to be a pig.
Yeah.
So that's what this type of policy does. And so I kind of went in with the other angle, and I tried to show them that right now the poverty guidelines are so jacked up. They're extremely irrelevant. Like, the federal poverty guideline, 100% of poverty for a family of 3 right now is $21,700 and some dollars. I think like 720 or something. And so I tried to give it a realistic view of, what does it look like to try to raise 3 people on $21,000? Because to me, that's not poverty. To me, that's like, it's destitution. And so when I went to Congress, I tried to just, my big thing was I pointed out that they receive $40,000 a year for office furniture, which is actually more than what the federal poverty guidelines say a family of 7 can make and still qualify for any sort of assistance. And so that was the approach I took then, was to just point out the hypocrisy in the system and how twisted, that formula for the poverty guidelines is from the 60s, where a lot of people didn't have to work 2 jobs, a lot of families didn't have to have 2 income winners. And so that was kind of my point. And what I tried to approach them was just to point out, the federal minimum wage is $7 and something an hour. But even if you're working for $10 an hour, it would take, this many people to make enough money to buy your office furniture for a year, and that was the approach that I took with that.
Speaking to that fact that the official poverty measure is so outdated, I've done reading on it myself and doing the work that I described to you, building a welfare cliff calculator. I was getting so frustrated with these numbers I was working on. I was like, where do these numbers even come from? Like, who decided this? How does that even come about? And in my reading, it was in the 1960s. One particular person was put in charge of creating an official poverty measure. They did not intend it to be the official poverty measure themselves, but that's what they were tasked with doing. And that's what came out of the work that they were doing. And when you read the Social Security's own history of how that came about, they say that the person working on it didn't have good data for this, so they just made assumptions for this and that. And when they didn't have modern data for them in the 1960s, they used 1930s data. So we get a cost of living adjustment to this basic algorithm, to whatever result comes out of that math. We have a cost of living adjustment every year, but it's again, so much lipstick on a pig. And it's incredibly frustrating to be continuously tied to bad data. And so, I'm so thankful that you stood up and you said something to that effect, myself, because that gets lost a lot in these conversations when we're talking about, well, you don't qualify for a safety net program. What's your problem? You should be totally fine. You don't need any help. When the measures we use to define who gets help and who doesn't get help are so horrifically outdated.
And everyone also thinks that, if you're on a safety net program, that you're like, you're living high on the hog, I'm trying not to talk too Appalachian, but high on the hog. And so,
Right.
whenever, one thing that I tell people, I'm like, SNAP benefits here in West Virginia, you're looking at $1.29 a meal, no more than
Yep.
$1.32 a meal. So, that allotment is going to get you $3.87 a day for food. So I think it's just a misconception. First of all, that poor people are lazy and that everything's their
Right.
fault. When on all actuality, it's because the way the system is designed is that you can't get ahead, you can't get a hand up. And that was a huge part of my talk in Congress as well. I told the story about a really dear friend of mine. She has twin daughters, who at this point were seniors in high school, and they wanted to help her because they had all, teen kids have expensive wants. And so they wanted the newest iPhones, and they wanted this and they wanted that. And their father had passed away. And so their mom was a single mom. And she also had another daughter as well, who was younger. And she's like, y'all are going to have to help me. So her kids went to work, and one of them went to work at Hardee's, which is a burger joint. The other one went to work at McDonald's, which was a burgers joint. And then what happened was that DHHR, the Department of Health and Human Resources here, required her to claim those girls' income on her review. And so what happened was that Michelle lost her SNAP benefits, and she also lost her Medicaid for herself. And so Michelle weaned herself off of her blood pressure medicine. And Michelle was a Black woman, and so we know the statistics when it comes to Black
Right.
people with, blood pressure, hypertension, and strokes. And so it was even more detrimental for her that she keep that insurance. And so it was, here the kids are, they're trying to help their mom. They're trying to, lighten that load a little bit. Maybe there would have been hope that she could have gotten out of that safety net program. But then bam, DHHR came right around and said, hey, we're going to pretend like every penny your daughters make go right into helping you keep the lights on, and so it's just the system. Everyone likes to say that system is broken, but it's not broken at all. It works exactly like it's designed to work.
Right. Right.
And I said, when it comes, I talk about the safety net a lot, and I can't stand to use that expression. In fact, I'm working with a group right now where we're going to try to rename it because it's really not a safety net. It doesn't catch anyone. And if it does, it just ensnares you there. And so it's more like if you're in an Indiana Jones movie and you're walking through the jungle and, that trap catches you and that net puts you in a tree and you have to hang there until somebody comes and lets you down. Like that's what the safety net does for Americans poor, and
Right.
So we just really need to dismantle the system and build it all over again. That's my opinion.
Yeah.
But
I share very similar opinions. I mean, I'm sure we could definitely talk shop on that for quite a while. Dave, let's start a podcast. Well, we're at about 45 or 40 minutes or so into this, and yes. Safety snare. I love that. Is there anything else that you would like to share with Code for America and the Brigade Network volunteers on any of the topics that we've talked today?
Actually, I'm just a true transparent moment. I'd never heard of your organization until I was approached by UNM. And so I've been telling a lot of people about it. I don't think any of us were surprised when there wasn't a Code for America in West Virginia because we don't have internet. Or if we do, it's real shitty internet. So, shoddy, sorry, internet. And
no, you're fine.
And so I'm just interested in the whole process, and I think it's fantastic that there are people out there who have found a different way of just helping the good. And I thank you all. And the more I can learn about it, the more excited I'm going to be, because we can't have too many people working on this, Right. And so from the bottom of my heart, thank you all. And I'm sorry that people aren't more aware of what you do contribute to the fight. So I appreciate you.
Well, thank you so much for sharing. And again, I'm just so glad that we've had the opportunity to have this kind of talk today. I have brought myself into that Code for America space from, really excited seeing that work and seeing that focus. And I'm just hoping that maybe maybe this time next year, there will be some Virginia representation or West Virginia representation at Brigade Congress. But yeah, I don't know I don't know that we have any specific questions asked just yet, but I'm willing to open it up to that if you think it's time.
Yeah, we don't have a lot in the Q&A box. Given that there is some time, I might try to ask a big one, but
Sure.
so you mentioned like we've got to just kind of break and rebuild the system. And what would, I wonder if you might share, like, what would that look like? Doesn't have to be the entire thing, but thinking of a future that, you know, maybe some of us can help build someday. How would that work? Or what would it look like for someone in poverty?
I think the first thing that I would do would be to really examine that poverty guideline. And then we would need to make a decision as to whether we were going to continue to expand that, to stretch that line, or if we were going to fight for livable wages, you know, because again, it's all intersectional. And so I think that there is a way for us to do this and point out, you know, it doesn't, it doesn't have to be, let's change the poverty guideline. It could be, let's just start paying people a decent wage to where they can afford housing and they can afford to get out of the safety net, you know, because that's a big part of it. And here in West Virginia, our minimum wage is actually higher than the federal. We have $8.75 an hour, but still, you know, we also have the oil and gas fracking boom here. And so people have really, they've taken that to their own advantage, and they have charged rents now that are $1,200 a month, you know. So again, it's just all intersectional, and I think it all comes back to pointing out exactly where the deficits. Oh, sorry, I need to let my dog out of the room. Where all the deficits are and how we're going to fix those.
Thanks.
Keep talking, and I'll be right back.
Okay.
No problem.
Well, Rene, I think there's a question in here that you could probably answer. There's one, are there cases where earning X plus Y before benefits will get you less after benefits than just earning something? In other words, is there earning more money can mean that you're worse off?
Absolutely. For my case in particular, my children depend on what's known as the Supplemental Security Income, which is a cash assistance program for disabled recipients who qualify for it. The algorithm for the calculation of that benefit has some fixed dollar limits that have not changed for decades. So every year I have to effectively make less money in order to maintain that benefit, because those fixed dollar limits don't change with the cost of living like everything else does. So every year we're on it, it's a fractional amount less. And the same for me is true for my particular eligibility for Medicaid. Medicaid's eligibility limit for my demographic is fixed at a 1992 limit that hasn't changed since 1992. So the more money I make, the more I risk losing my health benefits. And because I'm disabled, I have quite a lot of needs. And that's, even though making more money doesn't mean I suddenly get less in an actual dollar amount on Medicaid, you know, that's not a dollar benefit amount, it's just covers services. Trying to replace the expense of what I get from Medicaid is where I'd have to quintuple my income at the very least to just qualify for an ACA subsidy to hopefully then start saving on my healthcare costs. That would be astronomical. So.
Yeah, that's the cliff effect, right? And that's the biggest problem. Yeah. I mean, the cliff effect it's ridiculous. And I realize that there always has to be a cutoff point, right? Like, I mean, there has to be. We're not going into this unrealistically thinking that, you know, that there's not that level where you should be more independent, more self-reliant, you know. But the fact is, you know, what could be done? I think this goes back to changing the system. You know, after my talk to Congress, he's now Speaker, is he Speaker? Chief of Staff, Meadows from North Carolina. And, you know, in the beginning, he started with his opening remarks were that the hearing was a waste of time. It was premature. blah, blah. And by the end, he asked me if I could come up to him with a list of 3 ways that the safety net could be fixed to be more of a hand up instead of a hand out. And so I put this survey online. It's just a very like raw survey through SurveyMonkey, but we received almost 400 responses in less than 48 hours, which was huge for us. But the 3 things that people really needed, health insurance was number 1. That was because we have over 100,000 people here in West Virginia who are uninsured, even with the ACA in place. So
Right.
health insurance was a big one. Child care was another one, and then they all wanted living wages. And so, because of this cliff effect, like that could be one of the things that we start working on first. Let's take a realistic view of what everyone needs, and to really be able to get by. Years ago, our unemployment company here did a survey. It's probably been close to 8 years ago, and back then they said everyone would need $16.50 an hour to be able to just meet their minimum needs. That's not, extracurricular sports activities. That's not buying feminine hygiene products. None of those things were included. And so let's start there. Let's get rid of that cliff effect. Maybe extend that to where you'll have a 60 or 90-day period. SNAP is usually the first benefit that you lose when you
Right.
start to make more money or get a raise. And so
Right.
what would happen, because automatically when I was on SNAP, I received $584 a month for the 3 of us. And so that was automatically $584, like you said, that I had to come up with every month. And so what would have happened if they would have extended that cutoff point for 90 days? 90 days, 3 months, and at least allow me to get my head wrapped around the fact that I was going to lose that money. Right. So I think that would be one of the changes. Like, let's address this cliff effect crap first.
Yeah.
That's the answer.
Yeah. That's the argument I've always made. It's like the cutoff is so quick. Not only is the cutoff like bad math anyway, as far as like, the measure and whatever the amount it's paying, that's all bad math anyway, but the cutoff is immediate and there's no grace period. So if we're going to have a dollar cutoff, then there also needs to be an adjustable elastic time cutoff as well, so that people can build stability. They don't build stability.
Absolutely, because that's why so many people quit their jobs. Or, I one of the stories I told was a gas station clerk that I met. We just started talking about it. DHHR took this horribly hurtful SNAP fraud campaign on the road. They dropped $50,000 in advertising against SNAP fraud. And so every time I would see one of these posters that they paid for hanging in a window, I would stop and try to have it removed. Anyway, so I ended up having a conversation with a gas station clerk, and she told me that she had worked her hind end off. She was a single mom, and she had received a promotion to manager, but immediately she lost her housing assistance. She lost her Medicaid. She lost her SNAP assistance. And so we were talking about that. She had to go back in and give her promotion away. And so this is like, those are the stories that I feel we need to highlight. That's a huge part of my organizing work. Is how do we tell those stories? Because once you get kicked off those systems, it could take up to 90 days for you to get them back. Right. Especially with companies like Maximus and their cousins out there working against us. Right. And so that's most definitely, I think, one of the first steps in changing the system.
Right. Exactly. Thank you. I wanted to see, I saw another question here for Medicaid. I know it's income-based. Do assets prevent some people from keeping their Medicaid coverage? I would say that my experience with that is there's a couple of ways that the asset limits still do exist for Medicaid. Some states have what's known as broad-based categorical eligibility, which means if you're eligible for one means-tested program, you get shoehorned into others. Some of that waiver also allows states to choose to let go of the asset limit for Medicaid. So you'll see that that's highly dependent on region. It's just highly dependent on region whether or not, but in many cases, those asset limits are the same thing. They haven't changed in decades. The $2,000 asset limit for supplemental security income hasn't changed since 1984. And a lot of the programs take cues from the Supplemental Security Income program because it is the most, and TAMF, Temporary Assistance for Needy Families, are the base level welfare programs that the others tend to sort of like borrow and build from when they're making their own policies. So yeah, so that's why my focus tends to be purely on supplemental security income supplemental security income program, because that's where so much is originating from.
Great.
Let me see. I'm just looking over.
I just want to.
I had a question that I forgot, but go ahead, Em.
Yeah, I just want to like reflect back what I'm hearing a bit is that universal programs are needed. That universal is better than means tested. Maybe that our safety net needs to be destroyed and rebuilt again, and that everything is intersectional. This was one of the first times when I've been in a civic tech talk where there was such a clear line between environmentalism and technology. And so I really appreciate you bringing that all together, even though it's kind of at the showing that West Virginia is at the nexus of all of these forces of power and coal industry and underdevelopment and everything. Yeah, are there any other Q&A things that we want to lift up from the box here?
No, I wasn't sure. Let me go back to the Q&A. This is my first time like hosting a Zoom of any kind and working the levers from that end. So I'm definitely feeling the scramble.
Amy Jo, have you been working on broadband policy? I know you mentioned it a little bit. Is that kind of a federally determined thing at this point?
Yeah, it's mostly federal, and I really don't. That's not my focus. I know. I really don't know if a lot of us are working on broadband across the state, to be honest with you. But I know that our senators, Capitol Mansion, are constantly talking about it. So, and then both of them in the appropriations committee. So that might be helpful. You know, but my focus is mostly on safety net.
Great. Well, Rene, how do you feel about closing out? We've got lots of follow-ups we can do on some of these, and there is even, I don't know if you saw this, Amy Jo, but there's someone in the chat, which I think is a good distillation of how technologists work. Wondering if we could display the data that you recorded in the survey you are referencing around the safety net in a visualization or something. That's just, who knows if that would actually be useful or not, but now you have a team on your side who's
nice.
Here to make data visualizations for you.
Nice. I can send that to you, man.
Okay, sure.
Yeah, I know, I would love to see that. And I would say that as far as my closing notes would go, it's things just like that. Different ways of communicating these problems is where the technology would benefit most, rather than technology trying to solve the problem. So if that just means sharing a viral meme about these problems with your other meme-friendly technologists, do that. Build conversation around it, because the conversation is what builds coalition. And then that's how we get to change. So that would be my last word. And then Amy Jo, I'll email this to you too, but I shared in the chat a paper that I've read recently that I think is very promising when it discusses changes to the official poverty measure. He's the author in particular is a name that circles a lot of the same advocacy groups we're probably familiar with as well. So I find his opinion and his educated opinion on that to be fairly trusted. And I would just encourage anyone else. Yeah, meme challenge. I want these conversations about this stuff to be a lot more natural, because they're everyday talking points for people like Amy Jo and I. We talk about this stuff casually all day long. And I think other people need to be talking about it more naturally, more casually too.
Agreed.
Amen.
Amy Jo, thank you so much for joining us.
Thank you so much.
I can't
believe it's over already.
I know. I was sweating it earlier. And I'm like, wait, can we just like go on a little longer?
I mean, in West Virginia, we like to talk too. So
yeah,
just an intro. We can continue it on from there. So
thank you. Well, thanks everyone. please keep checking back on that discourse, because I'm gonna try and take the chat and follow up there as well, and then I'll follow up with you as well on that, Amy Jo, and see if there's more to add to it there.
Perfect. Thank you very much.
Thanks,
Thanks,
everybody.
guys. Thanks. Bye.
Bye.